Hi, thank you for joining us today for the first of a weekly series we are beginning entitled SNF Agora Conversations, the Politics and Policy of COVID-19. I'm Hahrie, a professor of political science and director of the SNF Agora Institute here at Johns Hopkins University. For those of you who don't know, the SNF Agora Institute is a new academic and public forum dedicated to strengthening global democracy by improving and expanding civic engagement and informed, inclusive dialogue. Like everyone else, we've been watching as events unfold around the coronavirus pandemic. And we've been thinking about how our collective response to the pandemic has the potential to exacerbate stresses that democracy all over the world has already been experiencing. So we created the SNF Agora Conversations, a weekly series that will take a social scientific, evidence-based approach to exploring some of the most vexing political and policy issues surrounding the pandemic. Things like public trust in government, media, and other institutions, the different responses governments around the world have had, disparities in the impact of COVID-19 on different communities, social isolation and how the pandemic is shaping the modern day Agora. Over the next few weeks, we'll talk with experts from Johns Hopkins University and elsewhere as we try to understand how the politics of the pandemic shape the way individuals, communities, and institutions respond. So today, I'm delighted to be joined for our first seminar by two people. Colleen Berry is a professor with the Johns Hopkins Bloomberg School of Public Health and chair of the Health Policy and Management Department. And Brendan Nyhan, who is a professor in the Department of Government at Dartmouth and a regular contributor to the New York Times Upshot column. So Colleen, Brendan, and I are going to spend about 30 minutes talking about the politics of information around COVID-19. And then we're going to open it up to your questions. So anytime throughout this conversation, you can submit your questions through the dialog box, which should be just to the right next to your video or just below it, depending on your device. So with that, why don't we turn to our panelists? So Colleen, if I can start with you, your research focuses on how health and social policies can affect a range of outcomes for individuals with mental illness and substance use disorders. You also look at how communication strategies have influenced public attitudes about things like the opioid crisis, mental illness, gun policy, and obesity and food policy. So I'm wondering for our audience if you can just start us off by synthesizing some of the key findings from your research about public communications around health issues.
Sure. I think the first thing to say is that we are in uncharted territory right now. The environment is changing incredibly rapidly, more quickly than I've ever seen in my lifetime. And major shifts are occurring in the basic fundamental ways that people are living their lives. On top of that, we are in a very different information age than has been the case with past infectious disease epidemics that we faced in this country. So any links to how communication of information operates from other health crises is at best, I think, incomplete. That said, there are some important principles that are relevant. First, for public health strategies to work, it's important to understand where and how people are getting information on how to act in this crisis. Who are the communicators of health information, and are they communicating accurate information to the public about how to reduce individual risk of infection and how to reduce the risk of transmitting it to other people? And this really taps into the core question of who people trust in our society for information, for guidance. So trust really matters tremendously in moments of crisis.
So let me follow up on that for a minute, if you don't mind. So what do we know about public trust in this moment right now?
Yeah, so we're struggling to respond to a pandemic at a challenging time in the sense that trust in government has been cycling downward for decades, and it has been at an all-time low for the past more than 10 years. Less than 30% of Americans trust the federal government to do the right thing. And we know that trust in politicians is very low as well. We do know that declines in trust in government reflect people's belief that it's hard for the government to resolve large problems. And this is one of the largest that we've faced and will face. Survey research suggests that few people believe that the government can be a source for good in our lives. So can this crisis change that? Or does it make things worse in terms of trusting our institutions of government? I think the good news is that trust in the scientific community and in the medical community is quite high, and has been for some time. We see around 70% of the American public trusting medical experts and scientists to provide accurate information and to do the right thing. So there's no question that scientists and medical experts are our #1 communicators right now.
And Colleen, just to clarify, a lot of the numbers that you just cited for us, are those levels in trust in general, or is that data specifically around COVID-19?
Those are levels of trust in general, our trust in government to act. And I think what I would say is, I think those broader low levels of trust in government likely translate to belief in the part of the public in how much faith to put in the government response to the epidemic, unfortunately.
Yeah. So this is actually a great way, Brendan, to bring you into the conversation. Because it seems like one of the sort of sources of growing mistrust in government is around misinformation. And your research focuses on misperceptions about politics and healthcare, including the effects of misinformation during disease epidemics and outbreaks. And so I'm wondering if you can talk to us, if you can just ground our audience a little bit in general what we know about the best way to counter misinformation. It seems like one of the things about COVID-19 that's potentially unique are the sort of very human consequences of having misinformation floating out there, which is different from, swaying the election or something like that. But there's a very kind of human cost to this. And I'm wondering if you can tell us a little bit about what we know from that research.
Yeah, it's an interesting point. One of the things that makes correcting misinformation about politics so challenging is that the accuracy incentives that people have are pretty weak. It doesn't actually matter that much whether your beliefs about whether the U.S. found weapons of mass destruction in Iraq are correct. It doesn't have any direct impact on your life. But of course, misinformation in this context can be life and death. And one thing we'll be learning about is the extent to which that changes people's decision calculus. Are they more discerning consumers of information? We don't know. To many people, this may still seem like a distant threat, and therefore they may be treating it more like politics, where again, those incentives to know if the information you're encountering are accurate are unfortunately pretty weak.
Yeah.
So in terms of how to correct misinformation, I would say we're still learning a lot about that, but there are some principles that I can identify for the audience. The first is to prevent the misinformation from gaining hold in the first place, because we found that these misperceptions, once entrenched, can be very difficult to dislodge.
Mm-hmm.
As they become more familiar, they come to seem more true. Just that repetition alone seems to be quite powerful in causing people to think that these claims they've heard might be correct. So we really want to stop misinformation before it gets a foothold, just like an emerging disease. The second point is it really matters whether those beliefs get mapped onto aspects of people's identity. So in politics, we worry about that, particularly when it comes to partisanship, which often is linked to belief in many of the most prominent misperceptions in politics in recent years. But it doesn't always have to be the case. There are, of course, misperceptions related to ethnicity and religion and all sorts of other identity factors that have been, unfortunately, quite powerful in different contexts and in different moments. So, when identity is involved, those motives may be much stronger, whether we realize it or not, than the motive to hold an accurate belief alone.
Okay. So can I just ask a follow-up question about some of those things, which is that what are the things that we know about how we can prevent misinformation from getting lodged in the first place? And, in terms of the layering of misperceptions onto beliefs, can you just say a little bit about what we know about how those things might get delinked?
Yeah, it's a good question. So one thing that matters a lot is what elites are saying. We know that when your side, whatever that might be, is espousing a particular claim, you're often going to be more likely to think that's true, particularly if you're the kind of person who identifies strongly with the group that speaker is a member of, and you're the kind of person who receives that information. So unified, accurate messages from elites matter a lot.
Okay.
And when they exist, they can be quite powerful. Oh, I should say elites. Yes.
So when you're saying elites, can you define for our audience, who do you mean by elites?
Yeah, thank you. So I mean here politicians, allied public figures in the media, the kinds of people you might learn from and hear their views about politics. So if you're a Republican, you might look to the president. You might look to conservatives in the media. If you're a liberal, you might look to President Obama or Nancy Pelosi or liberals in the media. Those kinds of people
Right.
Here in the U.S. I mean, again, it's going to vary around the world who the elites you might think are relevant are.
Right.
But those are the kind of people who can amplify these messages, and that can be for good or for bad. They can amplify accurate messages in quite powerful ways, and they can also sometimes amplify misinformation in ways that are quite pernicious and cause people who identify with their group to embrace those beliefs.
Right. Okay. So one thing, maybe Colleen and Brendan, both of you, if you could kind of speak to this. So I feel like sometimes when we talk about misinformation, there's this funny tension in the findings, which is that on the one hand, you're telling us that communications by elected officials and other people that we perceive as being elites really matter and can shape people's understanding of a situation. But then the other hand, you're also saying that people's views are really sticky. It's really hard to change people's views. And so can you just say a little bit about, particularly in an environment like the one we're in right now, where it feels like every hour brings an onslaught of new information where it's just changing so fast. How do we square those findings or those situations with each other?
So maybe I'll jump in first. Yeah. I think Brendan alluded to one of the important principles, which is that it's critical to get the right information out quickly and to communicate it in a way that is meaningful to people. So not too scientifically jargony information, but clear, concise information and advice about what to do. I think some of the tools that are tried and true of the communication field are helpful here. We've seen some very powerful examples in the last few days of the role of narrative, that is individuals telling stories specifically related to what's happened to them, relatives who've gotten very sick in their communities, and that being a tool for trying to heighten the sense of risk within certain communities and neighborhoods. So the way we communicate early on matters. I think, unfortunately, and again, Brendan alluded to this as well, we've had really conflicting information coming about around even the most basic aspects of the crisis. How soon are we going to have a vaccine? We hear the president saying relatively soon, and the scientific community saying that it's going to take at least a year. Mm-hmm. Can you get tested or not? Is it safe to hold rallies? When is the economy going to be able to get back on its feet? How long will this crisis last? Hearing different views really increases the confusion in the information environment. And the truth is, the media has never been more decentralized than it is now. There's no Walter Cronkite telling us what to do and think on the evening news anymore. People are getting information from all sorts of different sources.
Yeah, I think that's right. And again, what we should be worrying about when it comes to misinformation is these conflicting views kind of congealing into something that's stickier in the way you described, Hahrie. So it may be the case that at first people have no particular allegiance to any given understanding of what's going on. It's all so new and so fluid, as Colleen has been emphasizing, that I think people's views on this are changing day by day, sometimes hour by hour. But over time, there will be a kind of convergence. And the worry is that those beliefs, sometimes inaccurate ones or even dangerous ones, become linked to people's worldviews or belief systems. And downstream, that can have really harmful consequences. So an example I talk about with my students all the time is climate change, where in the mid 90s, there was no relationship between which party you identified with and your beliefs about the reality of climate change. At the time, that was not a high stakes issue, and it was not a partisan issue. Now that it's a very high stakes issue, it's so closely linked to partisanship and ideology that it's very hard to unwind that relationship. And people can become very defensive when faced with corrective information that conflicts with their point of view. So that's the kind of thing I worry about happening here. It hasn't happened yet. I think it's far too early, but it's the kind of thing we should be on the alert for, again, because the stakes are so high, even for people individually and certainly collectively, given the way that our behavior in a pandemic affects the health and well-being of people around us, not just ourselves.
Right.
And just to jump in here really quickly, I think we do see the beginnings of important threads of partisan formation in some of these attitudes and beliefs. For example, a Pew study that was released yesterday said 62% of adults say the media is exaggerating risks from the outbreak. And there's a real partisan breakdown there. Data is really changing rapidly. So in 3 days, those rates of beliefs around exaggeration may change, and what that partisan structure will look like is rapidly evolving. But I think that we do see certainly signs that the kinds of dynamics Brendan is describing are on their way to happening.
Hearing you guys talk makes me think about, a lot of the organizations that I work with are sort of civic organizations or faith institutions that seem like these are the kind of institutions that can play an important role in kind of moving us from a cacophony of lots of different ideas out in the information marketplace to certain ones congealing, and mapping onto people's social and political identities. And in the absence of having a lot of activity in that civic space, that it gets ceded to partisan leaders and the choices that they make in a way. So that actually, so I want to transition. That actually brings me to the next question I want to transition to, is starting to help us understand what the role is of different actors and institutions in our society and helping us find our way out of or navigate this very complex situation that all of us are in. And so, Brendan, maybe I'll turn to you first on this one, because you've tweeted already about the way that different social media platforms have responded: Twitter, Facebook, some of the big tech companies. So can you start by just describing for us, like, what has been their response and how has that compared to previous ways that they've dealt with questions of misinformation in the past?
Yeah, it's an interesting case study. This is a very rapidly changing area, even prior to COVID-19. Since 2016, the platforms, particularly Facebook, have been more aggressive in trying to counter misinformation on circulating on their platforms. But there are real limits to that, and I think appropriately so. I think there's a lot of squeamishness both within Facebook and in the broader country as a whole about one private company exercising so much influence on the political speech that people are exposed to. But the seriousness of this pandemic, the extent to which there's, by comparison, political unity on the threat and the danger that misinformation about this issue poses, that's changed the calculus for the platforms. So to the extent that we're able to observe this from the outside, it seems that they're being much more aggressive, particularly Facebook, in really policing misinformation on this topic. I think it's important to underscore that this is not a desirable model across the board. I don't endorse this approach when it comes to all political speech. But when it comes to health misinformation that can endanger people's lives, that has no, that is not just normal political speech, I think it's appropriate to take a more strict perspective. It seems like that's what they're doing here. As a result, while there certainly are examples of health misinformation, related to COVID-19 circulating on the platforms, their reach seems to be much more limited than we might have feared based on prior experience going into this crisis. So while we need to remain vigilant, I would actually say that in terms of where people are getting bad information, I'm much more worried about mainstream media actors who are denying the severity of the crisis for far too long than I am social media, although there's certainly bad examples there too.
So can you just say a little bit more about, so when you say that they're regulating misinformation more stringently now than they are in other domains, can you say a little bit more about how they're doing that? Like, is that using the army of 30,000 fact checkers that are there? What's the actual thing that they're doing? And then also, how is it that their reach is more limited than we might think? Like, can you just say a little bit more about what that means, or what's the data that you're thinking about as you draw that conclusion?
So the way Facebook content moderation works is that there's certain categories of speech on the platform that are taken down if they're identified. Calls for violence, things that are categorized as obscene or inappropriate for the platform. And then there's these certain categories, misinformation about the census or how to vote. So they have these specific categories of harmful content that their content moderators will take down, their algorithms will try to identify and take down. Everything else is only reduced in reach if their third-party fact-checking partners identify it as false or misleading. So that's the status quo going into this. What the platforms seem to be doing is treating COVID-19 misinformation as another category of speech that needs to be aggressively policed. So it's not in the bucket with standard political fact-checking where we wait for a fact check to emerge on this particular piece of content. They're policing it more aggressively, and they're using their content moderators and their algorithmic approaches to not just reduce the reach of that content in terms of how many people how high it is in your newsfeed. So in other words, how likely you are to see it, but whether it's even on platform at all, right? So that's a really critical distinction. Again, with the fact check content on Facebook, what they're doing is they're moving it down in your newsfeed. So you would have to scroll really far down if you had a friend share a particular piece of fact check content with you to find it. Whereas with these harmful pieces of misinformation in these categories they've identified, like COVID-19, it would potentially be removed from the platform altogether.
Got it. And just to follow up on the question about when you said that their reach has been more limited than we might have thought initially, can you say a little bit more about what that means?
Yeah. So when you see these stories online about misinformation and social media, I welcome attention to this issue, of course, but it's always important to keep scale in mind. Facebook is vast. Any piece of content on Facebook can reach thousands of people, and that is not a big deal at all, given the scale of that network. And so it's really important to keep the size of the potential audience in mind. So when I say the reach is limited, what I mean is the kinds of misinformation that are being covered in the mainstream media as examples of harmful misinformation in this category are very worrisome. But the ones that I've seen often have view counts or other kinds of indicators of engagement or exposure that are in the thousands or tens of thousands. They're nothing like the most viral fake news stories from 2016, which were often in the millions.
Right.
So there's a real difference. Now, that's not to say that some pieces haven't reached that scale, but it seems like they're intervening earlier before these things metastasize in quite the same way. And that has some really helpful consequences, both in protecting you from misinformation out there in the world, but also in discouraging the actors who might be promoting this kind of misinformation for political reasons or for profit. Any of those folks who are acting strategically might see that actually this is really difficult and move on to other things.
Yeah. So I want to get back to then something, Colleen, that you started us off with today, which is about the importance of scientific and medical expertise in helping us understand this situation. And I feel like when we talk about the role of the media companies and kind of regulating content and all the complexities that exist therein, there's this question of how do you begin to elevate the voices of scientific experts, and how do we differentiate those? So here I'm just thinking that, whenever we get into conversations about regulating content, there's this tension between democratizing the number and kinds and types of people who have voice and are given platforms in our media environment, but then also controlling the content to make sure that, there is that, misinformation, that facts and that kind of stuff are taken into account. And so, Colleen, just from what you've seen, what do you think are some of the ways in which media companies have been elevating the voice of the health experts that we would need, or are there other things that you think they could or should be doing?
Yeah, so as we talked about before, news media is not monolithic, and we live in a democracy and thus don't have great control over the content of the information that's being conveyed through the news media. And that's, I think, generally viewed as a good thing and an important part of the kind of society that we've built, and opens the door for misinformation to get in there. And so I think one thing that's been really important for me in my own research has been appreciating how much heterogeneity there is in the information that people are getting based on where they live and what news sources they are accessing. I think this is a moment to come together as a reporting and journalistic community to, in an urgent way, have the news media we are consuming be oriented toward the most updated facts that are available related to the science of the epidemic and what folks need to be doing. So this is really a moment of truth for journalists, for editors, for newsrooms to put science and medical experts sort of out in front. And I think that we all need to know what our role is. Politicians are not medical experts. You know, I'm not a physician. I'm not going to provide medical information on a program like this. So it really is sort of a call to arms for the media. I want to say, though, that people don't just get information from the media. And I think an important question is, what is the social fabric that we have in place to support individuals and to get information to individuals, especially those folks in our society that are most vulnerable? And here I'm certainly thinking about the healthcare sector and social services, but not just those, but other areas of civic life and civic engagement. Our churches and synagogues have voices to point people in the right direction. Our community groups have a role in addressing frankly, the social isolation that is coming out of this period we are in, and that social and emotional support that is critically needed. The challenge is we need to find new ways to support each other as a society, and those civic organizations need to find new ways to touch their membership. So everybody is, I think, racing to try to make those adjustments. But it does make me think of the old work by Bob Putnam, the sort of bowling alone ideas, those sort of soft touches in our community that go beyond our direct family and friends matter tremendously. And can a crisis like this strengthen those ties of society? Probably only if we find new ways to connect and support each other.
That's great. Brendan, can I ask you also to kind of weigh in on what you think could be done? You know, with every crisis, there's also an opportunity as well as challenges. And so if there is this opportunity to remake the way in which some of the media companies deal with information, I'd love to hear you weigh in on that. But just before you start to answer, just one thing I just want to say for the audience is that we're going to transition in just a few minutes to taking people's questions. And so if you have any questions, please enter them into the chat box now, and we'll be turning them, I'll be sort of reading them out to Brendan and Colleen as we get them. So Brendan.
Yeah, well, I mean, these aren't normal times, so I don't know if these changes will last, but I think under the circumstances, it's important for media organizations to rethink their approach to covering politics. Mm-hmm. There's been a way, it's always been a matter of life and death in a way, because of course, politics is about how we spend our scarce resources to make our society better. That can't help but affect people's lives in all kinds of ways, but the stakes are even more clear now. So covering politics as a circus, engaging in theater criticism about who said things the right way or the wrong way, remaining agnostic about matters of fact where the scientific evidence is dispositive or overwhelming on one particular side. Those are all, I think, profoundly irresponsible practices in general, but especially in this context. We need to take news coverage seriously, and that may mean centering, for instance, health and economic reporters with specialized expertise in coverage of this crisis, and moving those political reporters who have no expertise in those topics away, because they will focus on the narrative and all of those things that our political coverage often emphasizes, and we risk not holding people in power accountable for how well they are addressing the massive economic dislocation that's going to be taking place, of how well they're managing this massive health crisis that we're facing. The media speaks for all of us in those moments. They are one of the most immediate forms of accountability that we have. And I really do hope that they take that responsibility seriously, and that people recognize, however imperfect the media may be, that they are playing a vital democratic role in this moment.
Right. So I actually want to turn, I think that's actually a great transition to a question that we have from the audience. And so there's a question that came in that said, how can we use the lessons from person-to-person persuasion, such as deep canvassing? And it always warms my heart when someone from the public is drawing on social science research to pose a question, to communicate with our families, friends, and neighbors. And so, Brendan, maybe I'll sort of turn that one over to you first. If you could just start by telling the audience, maybe for people who don't know, like, what is deep canvassing and what do we know about person-to-person persuasion?
Yeah, well, this is where the host is being too humble about her being the right person to actually answer this question. But I'll speak on her behalf and just say it's a method that people have used in trying to think about how to engage in political persuasion at scale, but in a more meaningful way than just simply sending someone a postcard or showing them an ad. Instead, engaging in a kind of conversation where there's a real reciprocity, there's a listening that takes place and a sharing of your perspective. And some research has suggested that this kind of intervention can be quite powerful. We're still learning about how it works and why, but I think it's fair to say that it at least shows that interpersonal social context is a powerful one in which minds can be opened. People's beliefs can be changed. We often give up on those notions, but I think we shouldn't, especially now. And in your social network, you can be a quite powerful voice, whether it's for social distancing or other kinds of pro-social measures that will help address this epidemic. You can play an important role. And those principles of deep canvassing, of listening and engaging with people on their terms, I think could be quite powerful. And in a small way, if we all do it, could make a difference.
And I just would add that, especially at this moment where views aren't hard and fixed, I think there's more opportunity.
Yeah, I feel like one of the things I'm really learning from this conversation is the difference between these moments where views aren't hard and fixed, right? And the sort of opportunity that sits therein, and then the sort of way that we handle the situation a year from now or 6 months from now when views are more fixed. And there's a real difference in opportunities that exist right now versus down the road.
Yeah.
So Brendan, I just have to follow up on one thing that you said. So I feel like a piece of your research that I cite all the time, or that I tell people about all the time, is your research on vaccines and what you have found in terms of, when there is misinformation around issues, other health issues like vaccines, what do we know about what kinds of things are most effective in combating that? And I know that some people would think, well, I'm going to give people a ream of peer-reviewed academic research to show the truth about vaccines, but that's not in fact what you found is most effective. And can you say a little bit more about that?
Yeah, I think it, again, as Colleen emphasized, we're all trying to figure out how much what we found in the past applies in this moment. But I do think there could be some lessons here, at least things we should keep in mind as we consider the response. What my co-author Jason Reifler and other colleagues found is that, just giving people corrective information that, as you say, throws science at people, saying these things you might have heard aren't true. All the science says vaccines don't give you autism, for instance. That was effective in our study at reducing belief in the myth in question, but it actually made people less likely to self-report that they would vaccinate a future child rather than more, as we would hope. So It didn't have at least the intended effect on people's behavioral intentions. We found a similar result when it comes to the flu shot. Reduce belief in the myth, but reduce behavioral intentions. And in both cases, those behavioral intention reductions were concentrated among the people who are most hesitant to begin with. So it doesn't seem to be an especially effective strategy to throw scientific information at people in these contexts. I'll give you one other quick data point, which is my co-authors and I studied misinformation about Zika when it was circulating in Brazil, another epidemic that recently took place. And when we gave people corrective information there, it had no effect on their beliefs about the beliefs in question, but it actually made them question some of their other beliefs as well. It seemed to make them more uncertain about what they knew. And we didn't find the same effect with yellow fever, which is a more well-known disease that is endemic in that region. So we think that these new diseases, people's beliefs may be more fluid. And in that context, telling them you've heard this thing and it's not true might not have the intended effects, not just on the beliefs you're targeting, but other ones that you're not. That's all to say, we really need to emphasize the factual information that we're confident about.
Right.
We can play whack-a-mole all day with the various myths that are out there, but we need to be reinforcing over and over again those important messages about washing your hands and social distancing and all the other things that are going to help us get through this epidemic.
Right. So we actually have a question from Brazil, which speaking of, and so this questioner asked, after a long cycle of mistrust in science and resulting decrease in research resources, and I would also add, trust and expertise of science over time, does this crisis present an opportunity to renew or rebuild some of that trust? I'm wondering what you all think. I know that at this point, we're sort of speculating beyond data in a way, but I'm wondering, based on what you all see, what you think.
So I'll jump in first. I think potentially, unfortunately, here in the US, we had some fairly serious breakdowns. Obviously, the breakdown around testing, I think, was enormously damaging in terms of the erosion of public trust. I think that there have been some true, what I would describe as public health heroes in their ability to be out there continuously messaging the kind of information Brendan is talking about. And those individuals and those voices, I think, can go a long way toward providing at least the kind of baseline we need to establish trust in the scientific community. I think, though, one challenge is there's still, with this specific crisis, quite a bit of information uncertainty. Just in a basic way, we don't know, because of the testing issue that we're all aware of, who is infected. We have only tentative information on how different age groups are being affected. We thought originally, with the data coming out of Wuhan, that it was just mostly elderly and health-wise vulnerable individuals, but now this most recent CDC data is suggesting that it might be more of a health risk than we thought to younger populations. And certainly how the crisis will evolve over time and how long it will last is an area where there is true scientific uncertainty. And so that makes it hard for the scientific community. It makes it hard for medical experts. It makes it hard for public health. And certainly it makes it hard for the media trying to report on this issue.
Right.
Yeah, I think that those are all important challenges. But I would just say, there are reservoirs of trust in science. While there has been a diminishment in trust in science that's been expressed, it's still one of the most trusted institutions in our society.
Right.
There are many, many scientific issues where there is no social divide over the validity of the science. And the challenge for us is to keep this in the category where there's social consensus around the scientific process, however imperfect it may be. And that's going to be critical because, exactly as Colleen emphasizes, this is science happening on the fly. Conclusions will be adjusted. People will revise their views. New findings will come to light. And it's going to be an ongoing lesson in how to communicate the scientific process to people in a way that maintains trust, even as the guidance we give evolves with our best understanding of the disease and the related phenomena that we're dealing with.
I think, just very quickly, one of the most just interesting things about an infectious disease contract, like an infectious disease context like this, when we're thinking about politics is what it means for the social contract. I think that we tend to think about health issues as individualized health issues of our own and our family members. But here, we're not just making decisions about our own health, we're making decisions about the health of our communities and the medical professionals in our communities. And that decision-making around collective responsibility is just fascinating, and I think will be studied for years to come. And has the opportunity to reveal a genuinely sort of surprising aspect of our natures if we can pull it off.
Hopefully not surprising, right?
Yeah,
So
hopefully
the truth about our natures. So I'm gonna use moderator's privilege here a little bit, just because I'm looking at the time, we're heading into the end of it, and I feel like I'm gonna lump a few questions together that we're getting. I feel like we're getting a few questions that are coming in from the audience that are asking you all to speculate on things like, how long will the social distancing last? Is that the right thing for us to be doing, and so on and so forth. And we're also getting another clump of questions that are about, what are the right trusted sources of information out there? So is the CDC website credible? Is it up to date? And so maybe I'll ask you guys to sort of think about those together, right? Which is, how do we think about answering these questions that people are all asking about? What do I do right now in this moment? And how long is this chaos in my home going to last? Or if you're in my home, it's chaotic at least, right? And where are the credible sources of information that I should be turning to?
Yes, so I'll jump in really quickly. And I think that our public health community has done an enormous job trying to stay ahead of the information. So the information that's coming out through local health authorities and in our cities and localities is continuously being updated. The head of infectious control at the NIH, Anthony Fauci, is an enormous source of wisdom and expertise for us at this moment of crisis. And I think I'll make a plug for our own institution. I think Johns Hopkins has been a tremendous source of information, both scientifically and medically. And I am indebted to the work of our preparedness experts to really get key information out in ways that are accessible to the public through both those private and public informational sources. So those are the sources that I would point people to in answering those very basic questions about and related to the importance of things like social distancing, which is very much what we're recommending right now.
Yeah, and I'll add that I think the CDC and WHO websites are a great place to start for the overall scientific perspective on the pandemic. And then I would say from there to go to your state public health agencies if you're in the United States. Given our federal system, that's where a lot of the response is being run out of. They're going to have the most specific guidance to your context. I would say in this, we've talked about the limits of the worst kinds of misinformation in this context, but there is a lot of unverified and out of context information floating around out there. Right. And so I would say if you're kind of trawling social media with an untrained eye, it's going to be very confusing and chaotic at best and misleading at worst. So starting with those established sources that can give you sound scientific expertise, sound public health expertise. And then if you want to drill down, finding those experts who really do know these fields well. Again, to plug Hopkins, there's a podcast called Public Health on Call that I've been listening to that is hosted by an expert in this field who interviews other experts in this field. I've been listening to a virology podcast to listen to virologists talk about the scientific response to the disease. So getting away from political and sports reporters who got thrown on this story, getting away from this guy told me this thing, and getting closer, even, getting away from the TV doctors and getting closer to the real subject matter experts. If you want to drill down, those are the people you want to be learning from, not some guy who put some post up on Medium and tells you he knows what's going on. There are a lot of kind of hucksters out there, and I think you should be nervous about them.
So I'm compelled to just first of all, just to plug the coronavirus.jhu.edu website, which is where we're being streamed from right now. But also, I think, as Colleen said, I feel very indebted to all my colleagues at Johns Hopkins who've been doing an enormous job just providing all sorts of information to the public. But second, to say that Brendan, the podcast that you just promoted from Hopkins is run by Josh Sharfstein, who's at the Bloomberg School of Public Health here at Hopkins, and he will be our guest on this show next week. So I hope you all will tune in then. So let me just pose one final question to you all, and then I'll wrap us up. But the final question I want to ask you guys is kind of a combination of a set of questions that have come in through our live stream, which is just that, if I'm just an ordinary person out there and I'm just trying to be a good person and do the right thing, what can I do? And in particular, what can I do given that so many of us are locked into our own echo chambers? And so maybe if you all can close with a few thoughts on what all of us out there can be doing as we try to navigate this crisis together. And then I will wrap us up in just a minute. So Brendan, maybe I'll start with you, and then Colleen, give you the last word.
Sure. So I'll give three quick recommendations. The first is to follow public health recommendations, to wash your hands and engage in social distancing. That's the most pro-social thing you can do right now. The second is to try to be a positive voice for accurate information in your social network and social context, whether that's offline or online. You are a credible, respected source in your social network, and you can do a lot in that context. There's a lot of local rumor misinformation that you might be able to help deal with, or at least limit its spread. And the final thing is to do your part to deal with the social isolation that this crisis is going to create for the most isolated and vulnerable among us, as Colleen mentioned. That's absolutely critical. Maintaining those connections is going to be quite important. My parents are at home right now, and I'm calling them every day because I'm worried that they literally don't have any contact with the outside world. And I think that's something we can all do to try to make this experience a little more bearable.
Colleen?
Yeah, so just to add to this, I think sometimes we feel powerless, that we can't make change in the world. And I think the incredible thing about this crisis is that we all have a role to play, and that all of our individual choices matter tremendously. And I think that's really the most profound form of democratic engagement, that through our policies, but also through our actions, we can take care of ourselves and the communities that we're living in. And I'll say, if one outcome of this is that more kids decide they want to be epidemiologists, I think that's a good thing.
I agree. Well, Colleen and Brendan, I just want to thank you so much for joining me today. I'm not too proud to admit that this is the first day all week that I put on a collared shirt, and it was definitely worth it to be in conversation with you all. I also want to thank everyone out there who watched our webcast and sent in such terrific and thought-provoking questions. I hope you all will join us next Friday for another SNF Agora conversation on the politics and policy of COVID-19. Next week, we're going to be discussing how and why different countries have responded so differently to the pandemic, and what lessons governments can learn as they think about preparing for future challenges. We'll have three guests, one of which I already mentioned is Josh Sharfstein, who is the Vice Dean of Public Health Practice and Community Engagement for the Bloomberg School of Public Health at Johns Hopkins. We'll also have Ann Applebaum, who is a Senior Fellow with the SNF Agora Institute and a columnist with The Atlantic. And finally, Ho-Fung Hung, who is a professor and chair of the Department of Sociology at Johns Hopkins. So please visit us at snfagora.jhu.edu for more information, and I hope to see you again next week. Thank you.